Hello, my name is Munira. I'm one of the doctors here. This should be Jacqueline White. Could you please confirm your age for me? Nice to meet you, Mrs. White. How can I help you? Okay, doctor, I have blurry vision. Blurry vision. Could you tell me more about that? Okay, started few months ago, maybe 3 or 4 months. 3 or 4 months. That's a quite long time. Sorry for that. Okay, is it in one eye or both of your eyes? Okay. Do you remember any trigger? I mean, anything specific happened? May have started this blurry vision? Did it start gradually or suddenly? Is it getting worse or is it the same? Okay. Do you have any other symptoms, Mrs. White, like eye pain or any redness? All right, that's assuring. Did you notice any change in seeing colors? Do you usually wear eyeglasses? No? All right. And did you notice ever that you see straight lines go wavy? Okay. Any circles around light? Any problems in seeing on the sides of your vision? Nothing. All right. Very good. So, any other symptoms like the headache? Any pain on combing hair or chewing food? That's good. Any weakness anywhere in your body? That's fine. Okay, and any joint pain at all? Okay, very good. Few more questions regarding your general health. Do you have any medical condition? Are you taking any medications? All right, polymyalgia. You're taking the steroids. For how long have you been taking the steroids? Okay, and how are you managing? Is everything okay? Is it well controlled? It's good to hear. Okay. So, do you have any allergies? Any family member have eye problems at all? Okay. And regarding your special habits, do you smoke? Do you drink alcohol? All right, very good. Mrs. White, this is the first time to have this assessment with you. Could you tell me more about yourself? What do you do for a living? Teacher, interesting. And who do you live with? 10 cats, that's amazing, lovely. I think it takes a lot of work to take care of them all. That's lovely. All right. You've mentioned that this blurry vision, it's now for the last few months and it's a long time. Had this affected you at all? You're working as a teacher? All right. Sorry for that. Don't worry, you are here now. We can definitely help you with that. All right. So, do you have any idea what might be causing this blurry vision? Are you worried about anything in particular? Thank you, Mrs. White, for answering my questions. I would like to examine you. That includes taking your observations. I mean, the heart rate, breathing rate, temperature, and blood pressure. And also, I would like to do some tests to check how well and how wide you can see, and also checking the back chamber of your eye with an instrument. It's called fundoscopy. All right, I will have a chaperone with me. Right, shall we start? Thank you. Mrs. White, thank you for answering my questions and for letting me examine you. Based on the chat we had, blurry vision, and you have 10 cats at home. Also, I can see that your vision is a little lower than normal, and I see some changes in the back chamber of your eye. I believe that you are experiencing what we call ocular toxoplasmosis. Do you have any idea about that? Simply, it's an infection with a parasite common in cats. Usually, Mrs. White, we don't prescribe any medication for this type of infection. But regarding your condition, you're taking the steroids that can affect your defense system. So it's very important to start you on medications. That's why I will refer you to a specialist for more assessment and more investigations like blood tests. And he will start you on a combination of medications. It's antibiotics plus corticosteroids. Would that be okay with you? Do you have any questions? Well, doctor, should I get rid of my cats? Oh, of course not, Mrs. White. I can see you're worried about your cats. Please Don't get rid of them. You can take care of them as usual, but with few precautions, Mrs. White. When handling the poo of the cats, it's very important to wear gloves. Also, it's important to wash the fruits and vegetables and avoid the undercooked meat. And it would be very, very helpful if your cats are up to date with their jabs and up to date with their vet reviews. How does that sound? One more advice, Mrs. White, it's very advisable to stop driving for your safety and safety of others as well. Okay? I will print you a leaflet about this condition to have more read about it. And Mrs. White, please, you are not alone in this. At any time you feel unwell or your symptoms are getting worse, please come back for a review. And I would be happy to see you in a few weeks to make sure you are managing well. Have a nice day. Thank you.